Understanding cholera. Cholera is a serious bacterial infection affecting the intestine and can be fatal if untreated. Characterized by severe diarrhea and dehydration, it leads to rapid fluid loss. Cholera is a major public health concern, especially in areas with poor sanitation. The disease is caused by Vibrio cholerae, which releases a toxin affecting the intestines. Public health initiatives focused on sanitation, hygiene, and clean water are essential. Cholera disproportionately affects developing countries with inadequate sanitation. Addressing these factors can reduce the burden of this preventable disease. Section 2. Identifying cholera. Symptoms and causes. Cholera typically presents with sudden onset of severe watery diarrhea, often described as rice water stools. Other symptoms include vomiting, muscle cramps, and rapid heartbeat. The primary cause is the bacterium Vibrio cholerae, thriving in contaminated water and food sources. Transmission occurs through the fecal-oral route, making ingestion of contaminated water or food the primary mode of infection. Early diagnosis and treatment are crucial for managing cholera and preventing complications. Oral rehydration therapy is highly effective in rehydrating patients and replenishing lost electrolytes. Prompt medical attention significantly improves outcomes and reduces the risk of complications. Section 3. The spread of cholera. A cycle of contamination. Cholera spreads rapidly in environments with inadequate sanitation. Contaminated water sources play a significant role in transmission. Food can become contaminated if washed with contaminated water. Consuming raw seafood from contaminated waters is another route of transmission. The cycle continues when infected individuals lack proper sanitation. Improving sanitation and access to clean water are essential for preventing outbreaks. Section 4. Cholera in history. A legacy of outbreaks. Cholera has plagued humanity for centuries, with devastating outbreaks throughout history. The first documented pandemic originated in India in 1817, spreading rapidly through Asia, Europe, and North America. The Broad Street cholera outbreak in London in 1854 is a well-known example of cholera's devastating potential. Dr. John Snow traced the source to a contaminated water pump, revolutionizing public health practices. Cholera outbreaks continue in modern times, particularly in regions with limited access to clean water and sanitation. The 2010 Haiti outbreak highlighted the vulnerability of populations facing poverty and inadequate healthcare infrastructure. Learning from historical outbreaks is crucial for informing current and future public health interventions. Section 5. Combating cholera, prevention and control. Preventing cholera requires a multifaceted approach addressing the root causes of transmission. Access to clean water and sanitation is paramount in breaking the cycle of contamination. This includes providing safe drinking water, promoting proper hand-washing practices, and ensuring adequate sanitation facilities. Vaccines play a crucial role in preventing cholera, particularly in endemic areas and during outbreaks. Oral cholera vaccines provide significant protection and are valuable for public health interventions. Health education and community awareness are essential components of cholera prevention. By implementing comprehensive prevention and control measures, we can reduce the incidence of cholera and protect vulnerable populations.